Assalamu alaikum friends, welcome back. Hope so you are all doing well by the grace of Almighty Allah. This is my third video on my YouTube channel Medical World. In this video we are discussing about the esophagus. The esophagus is a fibromuscular tube approximately 25 cm in length that transports food from the pharynx to the stomach. It originates at the inferior border of the cricoid cartilage C6 and extends to the cardiac orifice of the stomach T11. In this article, we shall examine the anatomy of the esophagus, its structure, vascular supply, and clinical correlations. Next, anatomical course. The esophagus begins in the neck at the level of C6. Here it is continuous superiorly with the laryngeal part of the pharynx, the laryngopharynx. It descends downward into the superior mediastinum of the thorax, positioned between the trachea and the vertebral bodies of T1 to T4. It then enters the abdomen via the esophageal hiatus, an opening in the right crus of the diaphragm at T10. The abdominal portion of the esophagus is approximately 1.25 cm long. It terminates by joining the cardiac orifice of the stomach at the level of T11. Next, we are discussing about anatomical structure. The esophagus shares a similar structure with many of the organs in the alimentary tract. First of all, adventitia, outer layer of connective tissue. Note, the very distal and intraperitoneal portion of the esophagus has an outer covering of serosa instead of adventitia. Next, muscular layer, external layer of longitudinal muscle and inner layer of circular muscle. The external layer is composed of different muscle types in each third. Superior third, voluntary striated muscle, middle third, voluntary striated and smooth muscle, inferior third, smooth muscle, submucosa and mucosa. Mucosa, non-keratinized stratified squamous epithelium contiguous with columnar epithelium of the stomach. Food is transported through the esophagus by peristalsis. Rhythm contractions of the muscles which propagate down the esophagus. Hardening of these muscles layers can interfere with the peristalsis and cause difficulty in swelling, dysphagia. You can see in the diagram of the esophagus of layer, some layers, the layers of esophagus. Mucosa, first of all submucosa, mucosa, submucosa, then mucosa and adventitia. Next, we are discussing about the sphincters of the esophagus, esophageal sphincters. There are two sphincters present in the esophagus known as the upper and the lower esophageal sphincters. They act to prevent the entry of air and the reflux of gastric contents respectively. Upper esophageal sphincter. The upper sphincter is an anatomical striated muscle sphincter at the junction between the pharynx and the esophagus. It is produced by the cricopharyngeus muscle. Normally it is constricted to prevent the entrance of air into the esophagus. Lower esophageal sphincter. The lower esophageal sphincter is located at the gastroesophageal junction between the stomach and esophagus. The gastroesophageal junction is situated to the left of the T11 vertebra and is marked by the change from the esophageal to gastric mucosa. The sphincter is classified as physiological or functional sphincter as it does not have any specific sphincteric muscle. Instead, the sphincter is maintained by four factors. Number 1. Esophagus enters the stomach at an acute angle. Walls of the intra-abdominal section of the esophagus are compressed when there is a positive intra-abdominal pressure. Prominent mucosal folds at the gastroesophageal junction aid in occluding the lumen. Right crus of the diaphragm has pinch-cock effect. During esophageal peristalsis, the sphincter is relaxed to allow food to enter the stomach. Otherwise, at rest, the function of the sphincter is to prevent the reflux of acidic contents into the esophagus. Now, friends, this is all about the today topic. No, inshallah, we will meet in the next video. At the end, kindly I request you to subscribe my channel and like my video. Thank you so much.